Hey guys, hey, how's everyone doing? I'm Dr. Green. You know, what we're doing today is we're talking about autoimmune conditions. We're actually doing an introduction to a non-drug treatment of autoimmune conditions using functional medicine and functional neurology. Now, what I want to do is go through a little bit of background about myself first. You know, you're here watching this video, you're here coming to one of my workshops because you want to learn about if I can help you with your autoimmune disease. You know, you've gone the traditional medical route, it's not working for you. So the first thing I want you to know is I am a doctor of chiropractic, and I love talking about why I'm a doctor of chiropractic. You know, the key thing is chiropractic gets pigeonholed into back, neck headaches. We know that. We know that they're great at treating musculoskeletal injuries. But as a profession, we're really based on a natural whole health approach towards getting patients better. More specifically, my training is in several fields of study. First and foremost, I am board certified in integrative medicine through the American Association of Integrative Medicine. I am licensed as a doctor of pastoral medicine. I am certified as a chiropractic neurologist from the American Functional Neurology Institute. I am currently enrolled in postgraduate training, A4M, Association for the Advancement of Anti-Aging Medicine, which is part of the University of South Florida Medical School in their Integrative Cancer Treatment Fellowship. I am board eligible as a doctoral clinical nutritionist from the American Board of Clinical Nutrition, and I've studied blood chemistry, advanced thyroid management, functional endocrinology, functional neurological and neurotransmitter support, and autoimmune management under Dr. Datis Karazian. I've also studied integrated cancer treatment under Dr. Kevin Connors, who is really one of the world-renowned integrative and alternative cancer providers. He has a clinic that's in Duluth, actually St. Paul, Minnesota area, the Upper Room Wellness Center. And you know, he's a great doc. I've had the very pleasure of learning a lot from him. So with that being said, you know, we're going to talk about autoimmune diseases. So if we talk about the big picture, part of your immune system isn't working properly. We talk about hypofunction or hyperfunction. Now, autoimmune equals autoimmune equals autoimmune. The only difference is which tissue is attacked. There's really no change in mechanisms. I don't care if you have lupus or MS or Parkinson's or thyroiditis or rheumatoid or Sjogren's or psoriasis. The mechanism is the same, you just have a different tissue involved. So if you're autoimmune against one tissue, you're probably autoimmune against multiple tissues. I actually use a test from Cyrex Labs. It's our array number 5. It looks at 24 different tissue antibodies to see where your body is attacking. The big difference between an autoimmune reaction and an autoimmune disease is really how severe the damage is. And what we're looking at is some people have severe damage, so it's a full-blown autoimmune disease. Some people haven't gotten that far, that bad yet, so we're dealing with not as severe of a problem. Now, there's no cure, but there are many natural protocols to greatly improve your life and preserve your body. And again, I need you to understand this. There's no cure for autoimmune disease. In my practice, I see autoimmune patients every day. This is my expertise, but I can tell you a significant portion of my patients can go into remission. Their body normalizes, they go into homeostasis. What we see is if they follow the recommendations, if I do my job properly, if they do their job properly, they may never have to worry about their immune condition again. Their autoimmunity is still there, but it does not affect them. This is akin to someone who beats cancer. You always have cancer cells in your body. You're always a cancer survivor. We know there's always a risk in the back of your mind, could it come back? But if you do the right things, it won't. That's what we're talking about here. So, in the US, autoimmune disease is increasing every year. Most cases are not diagnosed. Most cases continue to progress. Conventional healthcare has very little to offer besides steroids. Conventional and alternative healthcare doesn't understand autoimmunity fully. You know, it all leads to tissue destruction. So, our immune system, when we deal with an autoimmune condition, it's when it mistakenly attacks healthy tissues in our body. It makes what are called autoantibodies. So it doesn't distinguish between self and non-self. So I'm going to talk for a minute about autoimmune physiology. The immune system has two parts. We have natural barriers. We talk about your skin, talk about your lungs, talk about your ears, your mucus, the respiratory tract pathogens. How about your gut flora? They compete with pathogens. So you've got these natural barriers, the skin system, the lungs, the gut barrier, and then the blood-brain barrier. These barriers protect our body. And then we have white blood cells. With our white blood cells, we've got a couple of key ones I need to teach you about. And listen, I apologize. It's going to get just a little deep, but there's two concepts you have to understand. And the key thing is you either have an autoimmune disease or you think you may have one or you're concerned about one. So you need to understand this. This is really important for you. There's Th1 and Th2 white blood cells. Th1 are also called cell-mediated or the innate immune response. These cells are the front line of defense against any antigen. Th2, which is humoral immune responses or adaptive immune responses, they tag the invaders. They tag them with antibodies, which makes for a more efficient immune response if exposed again. Talk about vaccines. Tag something so your body can fight it more effectively the next time. It's a Th2 response. There's also Th3. These are called regulatory T cells. It balances the communications between the Th1 and Th2 cells. I'm going to give you an example. My daughter, she'll be 7 in a couple months. She's sitting on a seesaw in a playground. A senior, 12th grader, football player comes down and sits down opposite her. You know what's going to happen. She's going to go flying. The reason that a seesaw works that way is because it has a very narrow base. That's your Th3. That's your T regulatory cells. We have to balance that base. We'll talk more about balancing later, but just imagine that base that regulates it, that's Th3. There's something called Th17. In most autoimmune patients, Th3 is failing. So Th1 and Th2 become out of balance. Th17 cells cause tissue destruction. And then there's something called natural killer cells. These are your immune system's soldiers. Now, in an autoimmune disease, when the body attacks itself, you've got to balance that Th1, Th2. There are two separate responses in your body. When a person is autoimmune, one of these systems is hyperfiring or dominant. So the football player sits down, my daughter goes flying. That's a immune dominance. Balancing the system goes far in reducing your symptoms. So if it's Th2 dominant, Th2 is high. If it's Th1 dominant, Th1 is high. There's something called cytokines. These are chemical messengers between the immune cells. Now, the more out of balance the Th1 or Th2 cytokines are, the more tissue destruction there's going to be. The question becomes why? What would trigger your immune system to break down and attack itself? We're going to talk about two different things. Dysregulators, these are immune stressors. They cause the immune system to get imbalanced because of different stressors. Chronic inflammation from poor diet. You talk about your omega-3 to omega-6 ratios. How about bad blood sugar? Bad adrenal glands? How about hormonal imbalances? Neurological imbalances? Pregnancy? Low vitamin D levels? How about an active antigen? Active antigens are really like invaders. They cause your body to attack itself, but they come from outside. Chronic infections, infections in the gut, food sensitivities, environmental toxins, leaky gut syndrome. These things cause your immune system to attack itself, but they come from outside. How do we know what you're dealing with? Well, it's really quite simple. Proper testing. And I can tell you, in my experience for the patients that come into my office, the majority of their doctors have not tested their immune conditions properly. Sometimes they throw you on a medicine and that's all they ever do. Sometimes they run a couple little tests and they say, we think we have this problem. Well, just run the other tests and confirm it. It exists. The tests are there. Doctors don't use them, either because they're concerned about what you're going to pay through your insurance or not insurance, which is really not their choice to make. It's me as the patient's choice to make. Or number two, they aren't trained in what to look for. I see this a lot. Or number three, their clinical guidelines mandate that they do screening tests, so they only look for the bare basic, and then if they don't see that bare basic show up, they don't go further, or more importantly, they do show it abnormally, but they say, I'll see you in 6 months and we'll run more tests in 6 months. You're there because you have a problem. The test showed a problem. Go beyond that. So we know proper testing is key. It's one of, and obviously I get very passionate about this because it's one of my biggest pet peeves in my office is we have testing available to fix you. We just have to run the tests. So the specific literature is now saying that this condition called leaky gut syndrome is a prerequisite to autoimmune disease. Now, when the body attacks itself, the polarity or shift into this immune dominance causes activation and release of something called interleukin-17 cytokine, IL-17. This causes dramatic tissue destruction. But that's not all. IL-17 activates what is known as cytokine-inducible nitric oxide system, or INOS. This leads to severe tissue destruction in your body. So, if we really talk about the autoimmune triggers, almost always leaky gut syndrome's at the beginning of that. Each one of these steps can be greatly diminished with functional medicine supplementation. What we're looking at is you get tissue destruction, you get poor Th3 regulation, and then what happens is we have to get more imbalanced Th1, Th2 systems, which leads to more tissue destruction. And then you get activation of IL-17, leads to more tissue destruction. You get activation of INOS, leads to severe tissue destruction. And this is why we see a condition like rheumatoid arthritis go from my hands kind of hurt, or you know what, I feel great, but it showed up on a test, to I have trouble walking in the morning, but if I take my medication, I'm good, to patients who can't bend their knees or who can't move their hand because the nodules are so severe. That's that severe tissue destruction, and it's that progression that we see. So that's not even the scary part. 80% of your immune system is in your gut. What that means is if you have inflammation, it's going to affect everything. And I want to walk you guys through this. Gut inflammation, usually from an immune reaction, a food sensitivity, or an infection, causes inflammation. That inflammation creates those cytokines, those inflammatory cells, leads to leaky gut, which leads to more food sensitivities, which causes more inflammation. It's an endless cycle. Those inflammatory cytokines cross into the bloodstream. When they cross that blood-brain barrier, they go to the brain cells, and they react with them. They're called microglial cells. And then that causes inflammation in the brain, which is where I come up with the saying, fire in the gut equals fire in the brain. So, steroids. That's what we know. That's a medical approach. Well, they don't work because all they do is suppress the system. They don't fix it. They do nothing to correct the imbalances. Is there another option? Yeah, absolutely. What we do in my office with functional medicine is we remove the autoimmune triggers. We determine if you're Th1 or Th2 dominant. Now, proper testing is important for that. We're able to adjust what you're taking to avoid stuff, include stimulants to the dominant or weak side as we need it. And here's the key thing. I have a patient just the other day, literally, actually, I'm going to grab it. I want to show you guys this, okay? My staff threw it away already, but literally, I had a shopping bag. She brought in 2 shopping bags. The shopping bags had no less than 40 supplements in each bag. One of those, and I went through them with her, and I said, you know what, of all these 80 supplements, you can take 3 of them. The other 77 either had ingredients in there that were making her worse, or had ingredients in them that weren't helping her, or were such poor quality with so many excipients and fillers that taking them was not even doing any benefit for her. Talk about the money I just saved her just from getting out those supplements. But more importantly, she was making herself worse because she was pushing the wrong side of her immune response with all these supplements. You have to support Th3 regulatory system. We have to suppress IL-17 activity. We have to suppress NOS activity. So how do we do that? Well, first off, we remove the triggers. Leaky gut syndrome is a huge one. I use a protocol, it's called the RepairVite protocol. We also use colostrum for some patients. If you have cancer, I don't want to give you L-glutamine. We'll use colostrum as a tool. Gut infections, we have to fix them. We have to get rid of them. The patient, we just identified 4 infections on the other day. Hookworm, H. pylori, Campylobacter, E. coli. I mean, we're talking major infections and no good bacteria. No wonder she's sick. Unstable blood sugar, food sensitivities, chronic inflammation. All these things have to be fixed. Well, how do we know if you're dealing with any of these things? Proper testing. I say it over and over again. Running the right tests tells me what's wrong with you. In a functional medicine approach, we're going to determine if you're Th1 or Th2 dominant, and we're going to give or avoid appropriate supplements. A list of some things that stimulate Th1 responses. So, if you're Th2 dominant, these are good for you. Echinacea, garlic, vitamin C, immune stimulants, licorice root, astragalus, beta-glucan, maitake mushrooms, lemon balm. How about your Th1 dominant, so you don't want to take any of those. And so what stimulates Th2 responses? Caffeine, green tea, grapeseed extract, herbal barks like pine bark, white willow bark, lycopene, resveratrol, pycnogenol. Believe it or not, there are patients in my office, I will give them a gift card to Starbucks and say, have fun. Because caffeine is going to help drive their immune system short-term and help it. Now, there's much safer ways for that, obviously, and you know, I say that almost in jest, but for some people, it's not a bad thing. It can help them. Be careful with the adrenal issues with coffee and caffeine and a whole bunch of other issues. But the key thing is you want to support your immune system where it needs support. So, and we have to support the Th3 system. So a lot of my patients get put on vitamin D. And vitamin D is a prerequisite, sorry, I should say vitamin D deficiencies are a prerequisite for cancer. You cannot find in the medical literature cancers in patients that do not have low vitamin D. It just goes along with it. Glutathione. I use Oxycell with a lot of my patients. It's a cream. We'll talk about it in a minute. Glutathione recycling. There's some other systems you can do. Fish oils. Your cholesterol is good. Why am I giving you a fish oil? To help Th3, to help your immune system. Nitric Balance. This is a product we'll also talk about that a lot of my patients use because it helps that NOS system. Now, the role of glutathione and nitric oxide systems, specifically in autoimmunity, are well documented. Glutathione, we've talked about earlier. I've got a whole blog that I do just on glutathione. I definitely encourage that you look at some of my other videos. But it's a tripeptide compound. It acts as an immune modulator. It's an antioxidant. It helps liver detoxification. It's the main protecting antioxidant for our cells, mitochondria, the workhorses, the energy plants of our body. Now, mitochondria is where all energy is made. It's where protein is synthesized. It's vital, and glutathione protects it. I use a product called Oxycell. It is a liposomal cream that gets right into your body and it helps it function properly. Now, glutathione exists in two forms, reduced or oxidized. It's oxidized by an ingredient. I don't want to go and bore you guys too much, but glutathione peroxidase, and it can be regenerated from that oxidized state by another enzyme, glutathione reductase. The important thing is when you have immune responses, oxidative stress, glutathione is converted to the oxidized form to protect and quench that oxidation inflammation. And then it's recycled back to the other form, GSH, to keep the cycle going. The ability to activate glutathione reductase and recycle back GSH is critical for autoimmunity. It's essential. You have to go from the converted to the non-converted form and then back in order for your body to function. It's this recycling that occurs. So what does this? You know what? There's actually a product called glutathione recycler. Apex Energetics makes it. It actually supports the synthesis and recycling of glutathione. And it also supports the activation of glutathione reductase. You can take glutathione till the cows come home. I don't care. L-glutathione does not cross the liver and stomach barriers. It gets in, your body will use it locally in your gut. It never goes anywhere else. The reason for this is because it's too weak of a substance. You need to have those precursors, the glutathione recycler or the actual glutathione liposomally or intravenously if you want your body to use it. Glutathione recycler has cordyceps, great adrenal support, Centella asiatica, Celebium marianum, N-acetylcysteine, NAC, alpha-lipoic acid, L-glutamine, selenium, all these key nutrients that help glutathione get produced in your body. So, an environmental compound activates the immune system once glutathione levels are depleted. When that happens, your body breaks down and gets sick. High levels of glutathione are critical. Now, nitric oxide, you may have heard of arginine. We'll talk about the problem with arginine in a second, but nitric oxide is an important messenger molecule. It's involved in many physiological and pathological processes in the body. It protects and destroys autoimmunity depending on which isomer is expressed. So it's good and it's bad. There's three of them. NNOS optimizes neurosynapses, so it's neuroprotective. It helps your brain, it helps your nerves. ENOS helps tissues recover and regenerate. They increase blood flow, they help circulation. It dissolves plaques. It dilates blood vessels. INOS promotes tissue destruction, promotes inflammation, promotes autoimmune attacks. We talked about the cytokine INOS being really bad. So what Nitric Balance does is it supports the right systems. Do not use products that use arginine to raise nitric oxide with autoimmunity because it'll actually increase INOS, that bad one. There's a difference between using specific support for NOS modulation and the simple use of arginine to raise nitric oxide. Nitric Balance has compounds that are used to support ENOS and NNOS, the good ones, while dampening INOS. Healthy balance of nitric oxide helps the body support tissue healing, dampen tissue inflammation and destruction, modulate autoimmune reactions. And we're talking about huperzine A, vinpocetine, adenosine, L-acetylglycerol phosphorylcholine, alpha-ketogluteric acid, xanthanol niacinamide, L-acetylcarnitine, LAC. These are key nutrients. Even ATP, which is that building block for energy, these are key nutrients that are in Nitric Balance. So autoimmune modulation with both glutathione and nitric oxide is really important. If you put it all together, what happens is you've got this membrane, this mucosal immunity, and GSH, glutathione, and nitric oxide enhances repair of the mucosal immunity, the intestinal mucosa. So then they dampen the initial inflammatory response, and then they modulate Th1, Th2, and then they support the regulatory T cells, which activates that shift, and then they dampen Th17, and then they support tissue recovery. So literally, these two supplements go from the immunity to calming down the immune response, to balancing Th1, Th2, to supporting Th3, to dampening Th17, to healing tissues. They're really important. And you know what happens is with leaky gut, it's this vicious cycle. You have the loss of intestinal junctions. Your body breaks down. It creates inflammation, which causes antigens to go in and attack more, and it leads to sensitivities. So these supplements can help calm that process down. I also use RepairVite for leaky gut. This is a huge, huge nutrient that we use in my office. The RepairVite regimen requires a very strict dietary program. You have to follow the program to support the intestinal membranes. The dietary restrictions are not caloric. You can eat as much food as you want to. Whenever you're hungry, I actually don't want you to ever be hungry. Just eat all the time, but you have to eat foods on the allowed list. And the key thing is, I have patients that come in and say, hey, I'm on a very restrictive diet, I'm trying to heal my gut, but they don't take the nutrients in RepairVite, so it never heals. I have patients that say, I'm taking all these supplements trying to heal my gut, but they don't cut out the foods that are causing their body to get sick in the first place. You have to do both. Autoimmunity is a metabolic problem that involves multiple body systems. I often use the term web of physiological dysfunction in my office. So what is metabolism? Well, quite simply, it's when I eat food or you eat food, and your body converts it into energy. That's it. That's metabolism. So if you really think about it, 30% of our energy goes to which system? You know, if you talk about it, the endocrine system, that's your hormones. Digestive system, well, all your food's going there. The nervous system, the immune system, the cardiovascular system. You know what the answer is? The nervous system. Your brain, your spinal cord, and your nerves. So the take-home message for you, if you have, and again, if I bored you for the last 6 minutes, if I lost you with nitric oxide and glutathione, I went a little bit into the science behind it. I apologize if I lost you. Come back, hello, wake up, we're good. We're back to the easy stuff now. I want to talk about why you have to take those nutrients. If you have a metabolic problem, your brain's not going to work right because your brain is the most metabolically active organ in your body. So there's 3 parts of the brain. We've got cerebellum, we've got the cerebrum, which is the cortex, and then we have the brainstem. If we look at these 3 parts of the brain, they have to function right, and your body sends signals from one part to the next. If they're not functioning properly, then you're going to have a breakdown in neurological function. What's that going to lead to? Chronic pain, chronic fatigue, irritable bowel syndrome, urinary tract infections, fibromyalgia, migraines, poor posture. You know, think about Bigfoot. Think about I'm on Lake Norman. Think about all those guys out on Lake Norman in the summer. You know, all those bodybuilders that are out there. That's poor posture, and it's a brain problem. Adrenal gland stimulation. How about thyroid dysfunction, hormonal imbalances? All these problems metabolically that we see, your autoimmune dysfunction, all these problems metabolically that we see can be caused by your brain reacting the wrong way. So how does that happen? Chemical stresses, physical stresses, emotional stresses, they all cause the brain to fatigue. Fewer nerve impulses lead to more problems with the brain. Now, stressors in the brain can come from anemia, blood sugar imbalances, and just, you know, when I say anemia, I don't mean iron. A lot of people are like, oh, I don't have an iron issue. I don't mean iron, I mean red blood cell dysfunction. Iron can play a role. B6 or B12 can play a role. Pernicious anemia, folic acid. There's a lot of things that can contribute to the anemia that you have. I have a patient who has a condition that is genetic. She's of European descent. And so she has this anemia. It says, well, it's genetic. I can't do anything about it. Yeah, but your red blood cells still don't work normally. So you have this problem. I don't care if you were born with it, you still have it. And we still have to address what it's doing to your system and work with it to help balance it out. Blood sugar imbalances, hypoglycemia, insulin resistance or diabetes. Food sensitivities, gluten, casein, dairy, soy, egg, corn, coffee, rice, potato, other grains. Immune system imbalances, your autoimmunity. Poor diet. You should always have more omega-3s to omega-6s in your diet. What do I mean by that? If you eat potato chips, it's going to be a 1 to 20 ratio of omega-3s to omega-6. You eat white potatoes, it's a 1 to 5 ratio. Well, if you want the ratio to favor omega-3s, white potatoes are healthier than potato chips. How about salmon is a 15 to 1 ratio. 15 omega-3s to 1 omega-6. That's much better for you. Nuts are like 8 to 1. So the concept here is you want more omega-3s in your body, which is going to reduce inflammation. Thyroid function. This is a huge thing to look for. Prescription or non-prescription drugs that can drive brain function. Are you on an antidepressant? That's impacting your brain directly. Are you on a sleep aid, Ambien, Lunesta? That's impacting your brain directly. Chronic inflammation, hidden gut infections. They're all metabolic problems that create nervous system imbalances in your brain. Emotional stresses to the brain, the adrenal gland, causes cortisol imbalances. This leads to problems with insulin on your tissues. It raises blood sugar too high. You have high triglycerides, LDL, total cholesterol. High insulin and glucose levels cause a breakdown of your brain and nerves. So the cerebellum, in the back of the brain, and the cerebrum, the cortex, require two things to function properly: fuel and activation. Fuel is sugar and oxygen. We actually test oxygen levels in my office with the pulse ox. A lot of patients use oxygen therapy. We do exercise with oxygen therapy in the office. That gives you oxygen through our concentrators, and the exercise therapy is what we actually do to help activate those nerve signals and get your brain firing. Have you been told your lab tests were normal? Well, you know, I get a lot of people that come in and say, my doctor said my labs were great. I want you to understand, I use the same labs that your doctors use. Solstice, Quest, LabCorp are the three national labs in the Charlotte area. I use them all. Quest we see a lot of, LabCorp we see a lot of. You know, what happens is those reference ranges that come back, you get a range. They're not based on you or me. They're based on statistics. If you think about who goes and gets blood work done every 30 to 60 days, if you're going and getting blood work done every month, are you healthy? No, you're very sick. That's why you're going every month to get tested. So it's statistics. It's a bell curve that's based on everybody getting blood work done. It's a pathological statistic. What that means is if you're outside of that range, there is something wrong with you. But if you're within the range, congratulations, you're as healthy as everybody who's sick. So functional lab values are what I use in my practice. In functional medicine, we use published reference ranges. They are optimal ranges. They are healthy ranges. They're not just that lab range. They're narrower, and they allow us to reveal problems before they become so severe because they're more sensitive. So what we're really talking about is if you're here or here, it's an abnormal high or low. That's going to be flagged. Your doctor's going to see that. But if you're here, you're borderline. And your doctor's going to say you're normal, but you know what? You're not normal. You're out of the range that physiologically your body should be in. So that means that your body is breaking down. It's just not so bad that you have a disease that can be named after you, or you need to be put on a medication, but you still feel horrible. So, you know, TSH is always the biggest example I use. The medical ranges for TSH go from like 0.3 to 5 and change. Huge ranges. Well, even the American Association of Clinical Endocrinologists, big endocrine group, 8,000 endocrinologists, says the high end should be 3. 3.14 is what their research showed. Well, functionally, 1.8 to 3.0 is where I want you. If you're not there, there's a problem. You're not in a healthy range. So if you're 4.2, you're hypothyroid. Your endocrinologist should know that because their research shows it. But you know what's sad? He doesn't read his research like I do. All he does is he uses the lab's ranges, and they show normal. So he says you're fine, you don't need anything, and you still feel horrible. Based on your history, I may run a lot of different tests on you and look at them using functional values, a complete blood chemistry panel. Thyroid markers, 10 thyroid markers. Your doctor will run 1, maybe 3. Blood sugar markers, hemoglobin A1C, 5 blood sugar markers. Lipids, a lipoprotein particle panel to actually look at your risk of cardiovascular disease, not just your total cholesterol. CBC with autodifferential, looking for anemias or infections. How about liver, gallbladder, kidney? All these markers we're going to test for. Salivary hormone testing. I'm going to look at your adrenal markers, cortisol, 4 times from high to low. It should be high in the morning, low at night. So we're going to get all 4 readings. We're going to see where you are. DHEA, 3 estrogens, progesterone, and testosterone. All of these markers. How about a stool ecology profile? If you've got bad gut bacteria, dysbiosis, poor good gut flora, if you have infections, if you have parasites, I'm going to find it. It's 100 times more sensitive than what I can order in blood work. And we're going to do food sensitivity testing. We're going to look at gluten. We're going to look at multiple other foods. We're going to look at leaky gut syndrome. And we may do autoimmune testing to include measuring to see if your immune system is attacking over 24 different tissues in your body. You came here because of a concern about autoimmune disease. We have tests to specifically look if you're dealing with autoimmune disease. What makes my office different from every other office that you've seen, from every other doctor that you've seen in the Charlotte area, quite possibly around the world? I see patients from as far away as Manchester, England, British Columbia, Canada, or St. Thomas in the Caribbean. These patients have been to doctors, and they don't get better because they don't treat the patient the way they need to. We treat patients neurologically and metabolically. My neurometabolic approach to care is unique. I work with a group of 300 doctors around the United States that have gone through all the same hundreds of hours a year of continuing education that I've done, and we've established that neurometabolic practice is the field of study that's going to get you better. I'm here to tell you, no stone is left unturned to determine the exact cause of your dysfunction. I run the tests that are going to give me the answers. Absolutely. I want to know without a shadow of doubt, yes, this is your problem, no, this is not your problem. And we have that ability in my office. Life is a matter of choices. My goal was to reinvent your life this morning. I feel like I've done that. I've given you a lot of information on areas with your immune dysfunction, how autoimmunity happens, the two halves of your immune system, tools that you can use to help address autoimmunity, things we have to look at to get you better. But you know what? Knowledge alone does nothing. You have to take action if you want to see results. Now, I want you to ask yourself, if you decide to pick up the phone and call my office and schedule a consult with me, what's going to improve in your health if you make an appointment right now? What's going to get better? What chance do you have at finally getting the help that you're looking for? And more importantly, I want you to ask yourself, if you decide not to do anything, if you decide to continue on this path, I've talked to you about a blueprint to get better. Step by step by step, what you have to do to fix your autoimmune dysfunction, to balance it out, to normalize it, to get into that remission and stay there the rest of your life. If you don't do anything in 3 years, where do you see yourself? In 10 years, where do you see yourself? I'm here to help you. If you like what you've heard, I can sit up here all day and preach. I've obviously talked a lot, I can continue to talk that, but you really just have to do one thing. It's really important. You need to call my office, you need to come up and you need to make an appointment. You need to schedule that appointment for me to help reinvent your life. Now, here's the thing. My normal 2-visit process is $390. That's for 2 visits. It's my new patient approach that I do. Because you watched this workshop, for those of you here in attendance, because you were at my workshop, for those of you that have been here before, you've seen and learned from me. It makes my life easier. I'm able to discount that same 2-visit process all the way down to $60. That's your fee if you call and schedule to come in and meet with me one-on-one. At that visit, I'm going to do a full neurological evaluation. We're going to help identify what's causing your dysfunction. We're going to do a case review, looking at all of the causes that you've had done. What tests have you had done before? If you have a stack of tests, I have patients literally that brought me a binder, that brought me boxes of notes from their hospital stays, from their doctors. I will review that, and it will help me formulate the plan that you need to get answers and improve your health condition. The examination I will do will help me to identify where your problems are breaking down from. Neurologically, how is your brain functioning? How are your peripheral nerves functioning? How is your immune system reacting against your body? And it will give me the tools that I need to get you better. The first visit, if you can bring your spouse, I definitely recommend it. We're going to do a lot of testing. It's beneficial to have them there to work with us as we're doing the exam, but it's not required. Visit number 2, I'm going to sit down, I'm going to formulate my plan for you, and I'm going to tell you what you need to do. I will give you my best recommendations for treatment. I require that your spouse or significant other is at that visit because they need to know what we found wrong with you. We need to talk about a plan to get you better. I thank you very much for staying with me the last 40 minutes as we talk about autoimmune disease. My staff is waiting for you to schedule your appointments. I look forward to meeting with each of you one-on-one. Thank you very much.